Here is your question.
Okay, ma'am, I'm ready.
Okay, so if you've read and understood, considering it surgical anatomy station, please tell me what exactly are you looking at? What are these structures?
These are lungs.
How many they are and what are their parts?
There are two lungs. Right lung consists of three lobes with two fissures, horizontal and oblique, and left lung has only oblique fissure with two lobes.
Okay. Please tell me if you could identify this number 17.
17 is the superior lobe of left lung.
Please identify 22.
22 is inferior lobe
Of complete answer,
of
please.
left lung. Left
Yes.
lung.
Right. What is 10?
10 is oblique fissure.
Very good. Moving on to right hand side. If you could identify 18, please.
18 is superior lobe of right lung.
Okay. 9, please.
9 is oblique fissure.
Okay, good. If you could kindly identify 5.
5 is the inferior lobe of right lung.
Tell me the surface anatomy of the lung on the skeleton or on the human being.
Yes, it has the apex, which is at the junction of the medial 1/3 of the clavicle and middle 1/3. Then it has anterior border, which starts from the lateral border of the sternum. And then there is inferior border, which is at sixth vertebra at the mid clavicular line, eighth vertebra at the mid axillary line, and 10th vertebra at the
On the
I
back side.
forgot that. Yes, and then there is the posterior border, which is at the transverse process of the 7th, 8th, 9th, and 10th vertebra.
Okay.
And then there's the base, which is sorry. Then there's hilum, which is at the 5, 6, and 7 vertebra level.
Okay. Hilum is opposite to T5, T6, and T7. Right.
Yes.
Please tell me what are the structures which pass through the hilum of the lung?
Pulmonary artery and vein are the most anterior. Then there's bronchial artery and vein, and bronchi are the most posterior. And then there are some lymph nodes and also at the
Autonomic,
hilum.
some autonomic nerves. Okay, please tell me how many bronchopulmonary segments there are in each lung?
There are 10 bronchopulmonary segments in each lung.
Okay, right. There are certain nerves present in front of the hilum. Please tell me their relation, anterior and posterior relation.
Anterior is phrenic and posterior is sympathetic
And vagus.
and vagus.
Right. Could you please identify this structure here?
Yes, these are posterior intercostal arteries.
Okay, and number 3?
Number 3 are the greater splankling nerve branches of the sympathetic trunk.
Sympathetic trunk. Please tell me. Okay, sympathetic chain is very important. Please tell me what connects sympathetic chain to the spinal nerves.
The gray and white rami communicants and ganglion connects.
Preganglionic via central rami.
Yes.
Okay, so you mixed it up. Right. Please tell me. All right. If you could tell me that this is one, you could see the whole thorax is there, which is for the sake of description or for the sake of ease, has been divided into anterior, middle, and the posterior mediastinum, superior as well. Or you could say broadly superior and the inferior, and then inferior again into anterior, middle, and posterior. Please tell me the boundaries of posterior mediastinum.
Posterior mediastinum anteriorly has the pericardium, and lower anteriorly lower border is diaphragm, and posteriorly it has the T5 to T12 vertebra, and laterally bilateral pleura. Inferiorly there is diaphragm.
Yeah. What are the contents of the posterior mediastinum?
It has descending thoracic aorta,
Yeah.
and arch of azygous vein, thoracic duct, vagus nerve, uh, and also has recurrent laryngeal nerve, phrenic nerve, and some sympathetic trunk.
There is a
trunk.
term called thoracic outlet syndrome. Can you please explain that?
Yes, the neurovascular symptoms are caused due to the compression of the brachial plexus trunk or the subclavian artery in thoracic artery.
And
Due
patient
to patient presents with ischemia of the upper limb or
Okay.
paresthesias, numbness,
Yeah.
or pain.
And this compression is basically between scalenus medius and scalenus anterior.
Yes.
Right. Oh, please tell me what you understand by the term subclavian steal syndrome.
In subclavian steal syndrome, there is obstruction at the proximal subclavian artery, and the compensatory retrograde flow from the opposite vertebral artery to the upper limb causes some symptoms like dizziness, blackouts due to the decreased blood supply in the brainstem.
Yes, okay. Brain ischemia leads to, okay, because of the exercise on the arm. All right. Please tell me what are the branches of the, okay, can you tell me what this is?
Which one?
Yes, here.
Okay. This is brachiocephalic vein.
Okay. Basically, I want you to tell me. Right, you called it brachiocephalic. Okay, maybe it is arch of aorta. What are the branches of the arch of aorta?
Arch of aorta has three branches: left
Yes.
common carotid, left subclavian, and right brachiocephalic trunk,
There
which
is just
divides into.
one, okay, one brachiocephalic trunk.
Yes.
There's no right and left, please.
Okay. Yes. One brachiocephalic trunk, which gives two branches, like right common carotid and right
Yeah.
subclavian.
Okay, last question, please. If there is a clot which dislocates or dispatches from the deep veins of the calf,
Yes.
please tell me the course of it, how it would reach the pulmonary artery.
First, it will go to the popliteal. Then, okay, it is from the artery or the vein.
It's being dislodged from the vein. Always
Yes.
remember the plop or the clots are dislodged in the veins, not in the artery. But how it
Okay.
will
From the
reach the pulmonary artery?
Yes, from the lower limb, it will go to the popliteal vein.
Very
From
good.
that, it will go to the superficial femoral. From there, external femoral, then internal iliac, and from internal
Wait,
iliac, it
wait. Don't jump from external. Which external?
Femoral, I said.
No, from femoral vein, it goes to,
External iliac,
yes, external iliac
then
vein, then common
common
iliac.
iliac,
Yes,
then common iliac, then inferior vena cava,
now, yes. Then,
then right atrium, from
yes,
right atrium into pulmonary trunk,
no,
and then
through the AV valve, pulmonary, yes.
yes.
AV valve, and then pulmonary artery. Okay, good. Thank you.
Thank you, ma'am.
Right. Would you be able to identify this structure B?
Yes, this seems to be internal thoracic artery.
Okay, what is this G? It's just the pericardium reflected.
Yes, pericardium.
Good, thank you.
Thank you, ma'am.